Hello, everyone. Dr. Jennifer Teal here, and this is a brief lecture on coding certifications. So you have finished your coursework, now what? You might be wondering, what are the coding courses going to get you? Where should you go from here? What is your next step? So the first thing is really, are you intending on pursuing coding certification? If you're looking to obtain a job specifically as a medical coder, you will need to obtain coding certification. I'm going to walk you through two nationally recognized certifying organizations for coding credentials specifically. So you have what you see here on my screen is AHIMA, or what we call AHIMA. That is the American Health Information Management Association, and they offer coding credentials. You also have on this tab is AAPC. AAPC offers a variety of coding credentials as well. So these two are the most widely recognized national coding certification bodies. They both have other credentials as well. So if you're interested in clinical documentation integrity or clinical documentation improvement, CDI, they both have CDI credentials. AHIMA also have your academic-based credentials, such as your RHIT and RHIA. So really, you just need to figure out, what is your career goal? So what I like to say is, where do you want to go and how do you get there? That's what you need to figure out when determining what your career outlook looks like. What's your goal? First of all, that's the first thing you have to answer yourself. Where do you want to be? Where do you want to go with your career? Then you're going to do a little bit of research. So go to one of the job boards. I have AHIMA's Career Assist website open here, and this is their job board. You can use LinkedIn, Indeed, Glassdoor, any job board. But what you want to do is start your search to see what are the expectations of the job. Because once you figure out, what you would like to do for a career, well, what qualifications are employers looking for in order to hire you for that specific career? So I just opened up the AHIMA job board, and this is the default page. I have not entered any kind of search criteria or anything like that. It's just defaulted to the first one here, which is an inpatient auditor. And what I want to draw your attention to is when you come to the requirements and the qualifications, they're all going to be similar in that they're going to, somewhere on the job posting, it will show you what kind of experience or education or credentials that they're looking for. And in this case, this particular employee will accept either AHIMA or AAPC certification. And they're looking for one of the following: CPC, CIC, or CCS. So if this was a career that you were interested in, you would want to make sure that you obtain one of those specific certifications. And many coders end up obtaining more than one. So me, for example, I have the CPC and I have the CCS. So I hold one from AHIMA and I also hold one from AAPC. And that just makes you a little bit more well-rounded and allows you to be more diversified depending on what employers are looking for. If I click on this next one, is an inpatient coder. So this one says inpatient coder remote. And in this case, they're looking for RHIA, RHIT, or CCS. So this employer is looking specifically for AHIMA credentials. They don't say anything about the AAPC credentials in their job posting. So some are going to prefer one or over the other, and some will take either one. This next one is for a DRG integrity specialist. And if we look here, the requirements for the position, they are looking for a coding credential from, again, either AHIMA or AAPC. And they're looking for RHIA, RHIT, CCS. So those would be from AHIMA, or CPC or CIC, which would be from AAPC. So just go through some kind of a job board and figure out what positions are of interest to you, and then what kind of certification they require. Now back to the AHIMA page. This is their home page, www.ahima.org. And up at the top menu bar, you'll see certifications and careers, and then certification exams. That's where I'm going to take you to today. And you'll notice in the center of the page, these are all the certification exams offered by AHIMA. The CCA, which is your associate or apprentice level, your entry level coder. This one you will only hold for a limited amount of time while you gain additional experience. It's just to get your foot in the door with coding. And then eventually you're going to upgrade that credential with either the CCS or the CCSP, because these are your mastery level coding credentials versus your entry level. Some employers may or may not accept the CCA. Most of them are going to be looking for your comprehensive, your mastery level coding credentials. So CCA, CCS, and CCSP are the 3 coding credentials offered by AHIMA. And then they do have these other ones if you want to explore those as well. Those that are completing a degree program from a college that is either your HIT, your associate level HIM would be an RHIT, and your baccalaureate level would be an RHIA. So if you're completing a degree, an academic degree, make sure that you definitely, and I'm talking about the academic degrees in health information management and the ones that are in a CAHIM accredited program that do allow you to sit for these credentials. I would definitely recommend taking the RHIT or RHIA. Again, the RHIT is the associate level and the RHIA is the baccalaureate level. Take those based on your curriculum, and then if coding is an area that interests you, I would add on one of the coding credentials in addition, because your RHIT and your RHIA are your health information management credentials. They say that I have knowledge in all things related to health information management, which includes coding, yes, but also like release of information, privacy and security, compliance, everything dealing with the health records that we deal with as health information managers. So they're your well-rounded HIM credential. They don't say I'm an expert at coding. They say I know some about coding, but not that I am, have that comprehensive advanced knowledge of coding like your coding credentials would say. So when you get here to this page, what you're going to do is you're going to review these. Any of the pages you click on is going to be specific to that credential, and find out a little bit about this. What are the eligibility requirements, for example? How do you prepare? How do you apply for the exam? For the coding exams in particular, what code books do I need to bring with me? These instructions tell you, how long of a test. They're timed tests. It'll tell you how long you have to complete the exam, how many questions are on the exam, what the initial pass rate is. So here's about the pass rate. Here's the fact that this is a timed exam and that you have 4 hours to complete the exam. So become familiar with whichever exam it is that interests you and start working towards that. So this was AHIMA. They have the CCS, which is your certified coding specialist, and the CCSP, which is your certified coding specialist, physician-based. So the physician-based coder is one that works in the physician's office, the outpatient clinic, a group practice, or does the professional fee coding for a healthcare system. So we're billing for the providers versus for the facility. That's the CCSP. And the CCS is the certified coding specialist. And this one is experienced in inpatient and outpatient coding. This is more of your facility-based coder versus your professional-based coder. And then the CCA is, like I said, the apprentice level. They call this one, at AHIMA, they call it the Certified Coding Associate, CCA. And this is an entry-level coder exam. Now, when we look at AAPC, they have this area for certifications as well. And when you select that, they have billing certifications, auditing certifications, coding certifications, CDI certifications. They have a whole gamut of types of certifications, you can come here and view all certifications. So this is aapc.com. And what you're going to do is you're going to come to their certifications page, and then you can see here in the middle the subcategories. They even have practice management and compliance type certifications. So if we were to look at the coding certifications in particular, the more common ones are going to be your certified professional coder, or you've got your certified outpatient coder or your certified inpatient coder. Those are your comprehensive coding certifications. They also have a full range of specialty certifications if you were going to apply for a specialty area and that specialty required it, or you just wanted to become more knowledgeable in a particular specialty. So for example, the CEMC is evaluation and management coder. The CCC is a cardiology coder. We've got an ambulatory surgery coder. My recommendation would be start with the foundational coding credentials, CPC, COC, or CIC. That is your well-rounded, knowledgeable in coding. And then from there, if you figure that there's an area of focus you want to be on, that maybe you want to work in that cardiology clinic, maybe you want to work for a radiology imaging center, and that would help you become more knowledgeable in that specialty, then add that to your base credential. And so I'm calling these base credentials. That's not really what they call them, but you want your foundational coding credential first, because that's the one that's broader and is going to open up more opportunity for you versus getting a specialty credential alone that's going to maybe limit you to just that specialty. So I would always add a specialty onto a more comprehensive coding credential. And then they also, at AAPC, they also have an apprentice level credential, and the way their credential works is it's a little bit different, and I'm not sure exactly where the information is on it, but basically it'll be a CPC-A to indicate that it is the apprentice level certification, and that's when you don't have the required experience to go for one of the full-fledged coding credentials. They will put you in an apprentice status, and then eventually you will upgrade that to the full-fledged coding credential. So the one that's the full-fledged credential is the one that really should be your goal versus the associate or apprentice level. Because again, if you look at the job boards that we were looking at, so far we looked at 2 or 3 of them, and we didn't see mention of apprentice anywhere in there. So a Profi coding specialist, let's check this one out. As a Profi coding specialist, it's saying certified coder through AAPC, AHIMA, and it also, this one actually lists some additional organizations. I don't see that too often. Usually it's just AAPC or AHIMA. Now, in this instance, they don't specify which certifications, they just specify which organizations the certification must come from, which is a little different. So they're all, unique. Here we have a medical records coder. This one says, let's see what they're looking for. This one, it just says high school graduate or equivalent and a minimum of 2 years DRG-based coding. So basically they're looking for inpatient coding with experience using an encoder. So in this case, they don't actually mention a certification. But you also need to keep in mind that whether or not they require it versus prefer that you're credentialed are 2 different things. And you never know who you're competing against for these positions. So you want to make sure that you give yourself the best opportunity. And most of the time, I can just tell you they're going to be looking for coding certification. So now that you've finished all of your coding classes, make sure that you keep practicing, keep studying, and I would highly recommend that you do go towards a certification. If you're in a coding curriculum and coding is your niche, get one of the coding certifications. If you're completing an associate or baccalaureate level program in a health information management, a CAHIM accredited health information management program, definitely pursue your RHIT or your RHIA, because the credentials do carry weight with employers. You'll see that a lot of them do require it. I would highly recommend that. And both of these organizations have like study guide type materials that can be purchased. And I always get questions from students in terms of, where can I get some more practice exercises, or how do I study? How do I prepare? We always say practice, practice, practice. You have to continue practicing. Otherwise, you will forget what you're learning. And you can only learn by doing. Coding is very technical in nature, and the only way to master it is by doing it. So you can just come onto these websites and do a search. Like if I come to the AHIMA website, you see they have a store up here. If I go to the store and in the search for products, maybe I just put CCS. Maybe that's the exam that interests me, the CCS. You can see right here, Certified Coding Specialist Exam Preparation. My recommendation is always to go to the source. If you're going to take an AHIMA certification exam, why not use their prep guide? If you're going to take an AAPC certification exam, why not use their prep materials? So right here, you see when I clicked on prepare for the exam, CPC preparation course is one of the items. And the reason I say go to the source is because they know intimately what is expected on their certification exam. And so they're preparing you for that specific certification exam. So that's all about the coding certifications. Again, figure out where you want to go, and then how do I get there? Where do I want to go? How do I get there? What are my own personal career goals? And how do I set myself up for the best chance of success at that? And you'll notice in the field of HIM, a lot of individuals have multiple credentials because they want to make themselves well-rounded and demonstrate that they have mastered certain things, that they are, they can be an HIM director. Then you're going to want the RHIA or RHIT certification, because the HIM director is responsible for the entire department. And that department is going to include coding. It's going to include release of information. It's going to include maybe transcription, maybe scanning of medical records, delinquent charts. It varies from facility to facility, but most of your traditional components of HIM are going to include those elements. And so the RHIT and RHIA speak to that, because if you think about what you're learning in your curriculum, it's all of those things. You're not focusing on any one of those areas. You're focusing on health information management as a whole. And whereas the coding certifications say, I'm focused on coding and I am a master at coding specifically. So that's the difference between those two. And again, where do you want to go and how do you get there? So I hope you found this helpful, and I wish you all the best of luck in your future endeavors, whatever they may be.